Welcome everyone to this week's video podcast. I'm Brent Dodge and I have with me Brace Hayden and Gary Gales, both physical therapists here at Alpine Physical Therapy. Today we're in the Aquatic Center at the Blue Mountain location of the Peak Health and Wellness Center. It's a special location that we have access to at our Blue Mountain location to provide this level of care. And I've got Brace with me right now to talk a little bit about the pool and all that's available here. But also, what is it about aquatic therapy that makes it so helpful for some of our clients?
You know, Brent, the great thing about aquatic therapy is that using water as a therapeutic physical therapy tool increases some buoyancy, or the hydrostatic pressure helps take a load off of joints. So people who are recovering from injuries or dealing with arthritis, it really provides them a way of doing some low impact exercise for boosting their immune system, for getting their joints going, and just helping them get back into some physical therapy in a really comfortable manner.
So there's some patients, it sounds like what you're saying, that maybe this is where they'd start to take pressure off their joints, be able to move more freely and with less pain, maybe as a step in a progression towards some land-based work?
Yeah, we like to often use the pool as one of our therapeutic tools. Sometimes they're doing a spine program in the clinic, and we're also dovetailing a program out here in the pool for helping work on some core stabilization exercises. We have a variety of the similar exercises we would do in the clinic that we kind of manage to use in the pool, which helps with their circulation, which helps give them some resistance from the water, but it also helps create some buoyancy so that they can move more freely in the water. And people feel a sense of stability in the water, and there's kind of a low threat when you're submerged in and 75% of your body weight has been lifted off of you doing pool exercises.
So it can certainly make things a lot easier for them to at least get started before they move on to something bigger. You know, I wonder, sometimes I see group classes, and I'm just wondering, at Alpine, how do you guys go about your treatments? Are you doing one-on-one, group? What typically is best?
Yeah, we usually start out people with a one-on-one type physical therapy where we're working with them. At times there are group classes in here, which is good incentive, as we like to promote that that's the next step. If they do well in the pool, we hope that they can get into more of a group fitness setting where they can be amongst their peers or amongst other people working on injuries in the pool. But it's typically a one-on-one situation, and we use both the cool pool that you can see behind you here, which is in the low 80 degrees typically, and we also have access to a warm pool, which is in the low 100 degrees for doing more stretches and that sort of work.
So when a person comes and you've done your evaluation as a physical therapist and you determine this person really would benefit with work in the aquatic center, maybe doing some pool therapy, do they typically spend the whole hour of physical therapy in the pool, or do you sometimes break that up? How does that typically work?
You know, it depends on a case-by-case basis, and we typically will spend the larger part of the hour, and some of it's going to be doing stretches, some of it's going to be doing gait exercises, getting them to walk in a bunch of different planes, some of it's doing balance exercises, some of it's doing range of motion and stretching in the warm pool. So it's a good mix. We try to start them out, see how they respond to it, and then the next time, if it looks like something we can progress, we might spend a little more time doing vigorous exercise.
Super helpful information. Right now, what I want to do is get together with Gary and share with our viewers some things about the conditions that we do treat using the pool here at Alpine. Technology is not our enemy. It is a tool. When placed in the right hands, it can do amazing things. Innovations in medicine, along with well-established techniques, make for amazing results. That is why I established a team that utilizes the latest in physical therapy technology. Person of Interest, sponsored locally by Alpine Physical Therapy. I'd like to have Gary Gales spend a little bit of time with us right now and share with us some of the conditions that are being treated in the Aquatic Center here at the Peak. where Alpine has its south location. Gary, what types of things are you guys treating here?
We treat a wide variety of conditions, but it goes all the way from back pain, chronic pain, all the way up to post-surgical. People that need to just get back to exercise are very deconditioned. So the buoyancy of the water basically takes away the force of gravity. So people can get back to exercise very easily. For instance, lower body conditions, sprained ankles, knees, post-surgical knees or hips or ankles. We can get in the water and be 70 to 80% unweighted and restore their gait function. They feel better. They're not in pain while they do it. Post-surgical shoulders to regain range of motion. We can start them using the water for buoyancy and put some of their tools, such as a foam dumbbell, in their hands, and basically let the water regain their range of motion instead of them going against gravity.
So that whole concept about the unweighting, I could imagine, like for a shoulder patient. Now, how quickly, for example, somebody that is post-op, they've had a knee surgery or a shoulder surgery, how soon would they be thinking about, well, I'm probably ready for some aquatic therapy?
Usually we wait for about 6 weeks and they need to be cleared by their physician. But that ensures that the incision is healed and there's no danger of infection.
Perfect.
But I typically get my post-op shoulder patients in the pool at 6 weeks, as I do my knees, post-op hips, all of those. And the other ones that works really well for are some of the central nervous system conditions. We have MS, Parkinson's, people that may have a difficulty feeling their bodies. The water gives them a sense of proprioception, and moving in the water is very easy and challenging for them. It provides resistance and buoyancy, so they're able to get in shape, and it's very safe. No danger of falling. Balance issues, great in the water. Deep end and shallow end. It forces the work of their core to stabilize against this buoyant effect. There's many different other conditions. If people just are deconditioned and want to get back to programming and they like the water and they want to use it for exercise and then for recreation, joining a class. So it works excellent for all those. And then there's the hot pool with the stretching. If they're super tight, if they have any nerve issues, it really responds well to the warm water.
So just a huge litany of conditions that I hadn't even stopped to think about that you are using the Aquatic Center for. So in your typical day, I mean, you see a lot of chronic back and neck pain, spinal conditions. I'm sure you're probably incorporating the pool. How does that work in terms of getting people better, back on their feet, back to maybe work or a hobby? How does that work?
A lot of times, people with back pain, they can't walk for long distances. They can't sit. They can't really do anything because they're working against the greatest force in the universe, which is gravity. But here it's our anti-gravity chamber, basically. The buoyant effect of the water negates the effect of gravity, and so they can get on there without this pressure on their discs and their facet joints and their nerves. They can perform the walking or other upper extremity exercises, and we can get them in the deep end and do some totally unweighted exercise, bicycling motions, things like that, and they start to strengthen and use their core muscles in all kinds of challenging stability ways. So after that, we can progress them to a land-based program, but a lot of times we'll start here and then progress from there.
Sounds very doable. Like you can actually get somebody started maybe earlier than in fact you could on a land-based program where they're going to see some success, get moving, get their cardiovascular going a little bit, and increase stability, mobility.
Exactly. In the cardiovascular, there's about 2 pounds per square inch of water pressure against the skin, so you get a lot more cardiovascular than you actually realize because the body, the heart and lungs have to pump against that pressure. So it actually works harder, but it doesn't feel like it's harder.
Ton of conditions and a ton of benefits. I appreciate you being here today to share that, Gary. Right now we're going to go to the tip of the day.
All right, here we are with the tip of the day. So I wanted to introduce a few of Alpine Physical Therapy's aquatic rehab pieces of equipment that we're going to be using in the pool. First of all, we use some resistive loops here for doing some lower extremity exercises. We also use some resistive band in the pool, similar to the ones we send people home with. These are our aquatic float dumbbells, providing a little more buoyancy for our walking drills, and we also use them for upper body and shoulder exercises. We tend to use the kickboard as it's a nice buoyant device that can provide resistance and drag on the water for increasing muscle strength. We'll use noodles as well in the pool to provide flotation and stretch for joints and to give people a feeling of steadiness in the pool, as well as some resistance for particular exercises. The aquatic jogger belts are often used in the pool as well for giving people increased buoyancy and the ability to walk in a more weightless environment. Lastly, we use a similar type buoyant tool for the ankles for providing resistance exercises in the pool, for lower extremity, and for core stabilization exercises.
I'd like to thank Brace and Gary for joining us today in this podcast on aquatic therapy. If you have additional questions, be sure to visit our website or call our clinics.